Hello friends, I'm Dr. Om Prakash Namaga, Consultant Pediatrics and Neonatology at Apollo Hospital, Navi Mumbai. Today I'm going to talk with you about vaccination in this COVID-19 situation. We are desperately waiting for a vaccine to prevent and treat the COVID-19 infection, isn't it? However, many of us are missing vaccines that they are supposed to take for their babies for their own. So it's very controversial situation whether to give vaccines or should we wait for the vaccines. Every day, so many phone calls that I'm getting that doctor, my baby is awaited for the vaccine. The vaccine was due a month prior, or vaccine is due today or tomorrow. Should I come to the hospital or not? Now, this is a very tricky situation where we are afraid to come to the hospital, where we are afraid to come to the clinic to give vaccination. So I thought let's discuss a bit about vaccinations, what they are, should we wait or not. So I'll divide the vaccination into two groups, primary vaccination and secondary vaccination. So primary vaccination is something which baby is getting for the first time. Okay. So these vaccines are the birth vaccines, the BCG, hepatitis B and oral polio. So we should make sure that baby gets this vaccine at the time of birth or before they get discharged from the hospital. Next set of vaccines comes at 1.5 month, 2.5 month and 3.5 month, like 6 weeks, 10 weeks and 14 weeks. Now these vaccines are also primary vaccines where the baby is protected against diphtheria, pertussis, tetanus, Haemophilus influenza, injection of polio or oral polio. This is very essential. We must have seen even in Western world that there are incidences of measles and pertussis getting on a higher side. So here also in India, we are very much afraid if your baby is not protected by this vaccine, there are very high chances that they may get this infection which can be fatal for them, which can cause significant morbidities and mortality. So make sure that we take this vaccine very much in time. So along with this 6 combination vaccine, we do give pneumonia. You must have seen pneumococcal vaccine earlier, which helps to prevent the pneumonias, the lung infection, and there are very high incidences of community acquired pneumonia in Indian scenario. So make sure that we get this vaccine for the baby. The third vaccine is the rotavirus vaccine. We must have again seen lot many babies coming with loose motions. So one of the contributing factor for the loose motions is this rotavirus infection. So rotavirus vaccine does help to prevent or decrease the chances of this loose motions caused by the rotavirus. So if you see this 6, 10 and 14 weeks vaccination, these 3 sets of vaccines, the 2 injections and the 1 oral vaccine, helps to prevent as well as decrease the chances of these infections to the baby. Next vaccination come at 6 months, which is the flu vaccine. We are worried about a viral infection of COVID-19. Similarly, years prior, in somewhere around 2009, there was a swine flu infection which was causing a lot of respiratory infections to the patients, a lot of infections to the adults as well as elderly and the kids. So swine flu vaccine helps to decrease the chances of infection caused by this H1N1 virus. So it is very essential we have to take 2 doses of this vaccine, 6 months and 7 months. Next in the series comes the measles vaccine. So we give this measles, mumps and rubella vaccine in combination. I already told you that the diseases like pertussis, chickenpox, measles are on rise because of the drop in the vaccination in the Western world, and with the delayed vaccination, we are expecting some peak of these diseases in Indian scenario also. So make sure you don't miss the 9-month vaccination of MMR, which is measles, mumps and rubella vaccine. Along with that, we do give typhoid vaccine as well as the meningococcal vaccine. Typhoid vaccine, as you know the name, it helps to decrease the chances of typhoid infection, which is a waterborne disease. With the rainy season coming in the picture, we should make sure that your baby gets this typhoid vaccine. The meningococcal vaccine, which is relatively newer vaccine in the vaccination chart, is also quite important for prevention of meningococcal infection to the babies. This can be given from 9 months onwards. So there are 2 doses of that. One is given at 9 months and subsequent dose is given on follow-up at the interval of 6 months. After the 9-month vaccination comes the 12-month vaccination, which is a hepatitis A vaccine. And in the newer chart, we do give the pneumococcal vaccine also, the booster dose of pneumococcal. Now, hepatitis A is an infection which is again a waterborne infection. which can cause jaundice, which causes a lot of morbidities to the patients. So hepatitis A vaccine is good to be taken at 12 months of age, and along with that the pneumococcal booster. Now I told you about primary vaccines and the booster vaccines. Booster vaccines are something which will help to boost your immunity, which has been developed from the primary vaccination. So for booster vaccination, there are doubts again, should we wait or not wait? I will suggest, if it is practically possible and feasible for you to come to the hospital, to come to the clinics to give the booster vaccine, you should still stick to give the booster vaccines in time, because this is going up to boost up the immunity of the child, again helps to decrease the risk of infection of that particular bacteria or virus that vaccine we are giving. So after this 12 month, we give the 15-month vaccination, which is again the booster of MMR, the measles, mumps, rubella, and here very important vaccine of chicken pox is there. This is for prevention of the chicken pox infection, the varicella infection. So make sure that your child gets the 15-month vaccination of MMR, chicken pox, and some of them who are not used the pneumococcal vaccine at 15 months, they use it at, those who are not used at 12 months, they use that vaccine at 15 months. So in this way, if you see the vaccination chart, as the time progresses, the interval between vaccines increases, but it is very essential that you take care of the primary vaccination as well as the booster dose of the vaccine. The flu vaccine is to be given every year, annually, because the strain of vaccine does change based on the guidelines of the WHO. So make sure that you, if you are not taken your annual flu, you should take that. Just additional note that we at Apollo Hospital are giving flu vaccine at a in a very cost-effective way, so that everyone is protected from the swine flu infection in present situation. So even for the mother as well as for the father, we do provide the flu vaccine. And for high-risk population, particularly those who have got a hypertension, diabetes, or elderly people, they should also take this flu vaccine. They should also take the pneumococcal vaccine, because the risk of pneumonia, again with this COVID pneumonia, we must have seen, there is a high chance of the secondary pneumonia infection. So elderly people should take the pneumococcal vaccine also. So this summarizes what are the vaccines, the primary vaccines and the booster vaccines, and second is, should we wait for the vaccination or no? So I will say there's a big no from my side to wait for the vaccination. All the primary vaccines as well as the booster vaccine has to be taken in time as much as possible. I hope this summarizes and answers most of the questions that you have got in mind. Thank you very much.